Choekyi, Tishtile.
Tishtile.
It's so lovely to see you and meet you in person
Lovely
here
to see you too.
in Kollegal Tibetan settlement in South India. First of all, I'm really proud of you being the first Tibetan osteopath and as a Tibetan woman, so congratulations.
Thank you.
And thank you for being so generous to donate your time and your expertise here to just share a little introduction on osteopathy and a little bit about your story and your journey. So thank you so much for that.
Thank you for having me.
And if I can begin, what is osteopathy?
So osteopathy is an alternative medicine where we focus on the musculoskeletal issues of the body. So it can be the issues coming from the joints, muscles, anything from outside the body. It can be from the nervous system as well. So we try and look at the root cause of each ailment instead of just focusing on the symptoms of the patient. And then we also try and help them with their management and healing as well.
And that's so needed in times like today, right?
Yes.
Where people are not looking for a band-aid to a symptom or a condition,
yes.
but they're really looking at the root cause, how to manage it.
Yes.
And I like a few things that you've said, that it's non-invasive,
Yes.
that it's holistic, and that you work with the patient's whole self,
yes.
including the mental health aspects.
Yes.
So thank you. That's really useful for me. So how is osteopathy different or similar to, say, physiotherapy?
So osteopaths, we usually diagnose the patients ourselves. As compared to physios, most of them have the patients being referred from the hospitals. And physios really focus mainly on the exercises, whereas osteopaths, we palpate the body and see if there's any tissue dysfunction, where it needs release in the muscles or the joints, and also give them home exercises. So I would say there's more hands-on going on in the osteopathy.
And how is it similar or different to, for example, chiropractors?
Yeah, so chiropractors believe that all the ailments in the body come from the spine, and whereas osteopaths, we believe that there's more, not just the spine, it can come from elsewhere in the body as well. So like if you have issues with your ankle, it can affect how you walk, and that's going to affect your lower back, and it can also give you headaches depending on how you function, and it's going to affect the elsewhere in the body. And also chiropractors use a lot of clicking of the joints.
Yes.
They usually do the manipulative treatment like HPT, which is the thrust clicking, and it's usually a shorter treatment session than an osteopath. And osteopaths are more holistic in the sense we use the massages, manipulation of the joints, and also stretching, so it can be more gentle compared to chiropractors.
And I guess chiropractors and osteopath both, you can refer yourself, right? You don't need to go to a hospital to get a referral.
No, you can go straight to osteopaths, physios, and chiropractors yourself. But you have all the practitioners work differently. If you're working in a hospital, you might get referred from the doctors. But if you are an independent practitioner, you'll have patients coming straight to you.
And what attracted you to be an osteopath compared to, for example, as a chiropractor or a physical therapist or a doctor even?
Yes, so I felt that osteopathy really aligned with the Tibetan medicine in a way, because osteopaths believe that body has its own healing system, and our aim is of the patient is to just readjust how the joints are moving, so that there's an optimum healing of the body, and there's no side effect in terms after our treatments, just like the Tibetan medicine where they use herbal. And also, like I said, osteopathy work on the biopsychosocial factors of the patient, not just the physical complaining symptoms, but we also see how their understanding of the pain is, and also their mental aspect of it as well. So I thought it was beautiful, coming
it's
from
karmic.
Yes. Being a Tibetan Buddhist myself, so I thought it was just for me.
I'm sure also your patients really benefit from somebody who comes from that tradition,
Yes.
and also with the purpose and intention that you bring
Yes.
from that Tibetan Buddhist angle. And Samten Choekyi, how did you train to be an osteopath?
So learned from British School of Osteopathy in London. It's a 4 years integrated master's course. So in order to be graduated from there, you need to have at least 1,200 hours of clinical practice in the clinic itself. So yes, so I learned from London.
And where else have you practiced? I know you've practiced internationally.
Yes, few places. So as part of the graduation program, like I said, we had to have many hours of clinical experience, and that was in London. And after my graduation, I came back to India, and I volunteered here in Kolkata, in our hometown, and for about a month. And then I worked in India, in Bangalore. And then after that, I went to New Zealand to practice for some months as well.
Fantastic. You must have got such a breadth of experience and also different people.
Yes, I have met a few different, a lot of different people.
And with that diversity, what are the most common conditions that you've treated?
I would say, since osteopathy, we look at patient as as patient-centered in a way, their symptoms and their understanding, their psychology. So I would say they're all different, even if it's even if it's with the same ailments. But for individual people, they're all different, and I would treat them differently from how I would treat you or someone else. So.
Sure. I understand the personalized approach, but what I meant was, are there any common themes? Do you notice some common conditions that keep coming up because of our modern lifestyles?
So basically, a lot of issues that I deal with is the neglected, and like the neglected in the sense not having a proper exercise routine, and neglecting, especially in the Tibetan community, not going to a doctor or see an osteopath or a physio until it's very severe. So they neglect it in the sense that they don't take it seriously, their health. And other would be a lot of ailments coming from the stress as well, especially in the West.
Yeah, and that actually leads really nicely to my next question.
Yes.
Have you noticed any differences between treating Eastern patients versus Western patients?
I would say more to do with the stress and the stress with the workload, and that really affects the healing capability of the patient as well. The more stressed you are, it's going to block. It's not going to allow the body to relax, and unless you are relaxed completely, it's not any effects. They won't have any much help. With the treatments, so you really need your body to be completely relaxed. So I would say, in terms of mentally, more stressful in the West as compared to in the East. And also there's, I would say, there's more like a family support here in the East, because in the West, when you're 18, you go out of your home, you are an independent person, so you support yourself, and it really stresses the body, and you feel less supported, and that also affects the healing ability of the body as well. So few things, differences.
And especially with stress, the more you get even more stressed out when you realize the stress is stressing you out, isn't it? So how does the patient sometimes break that cycle?
So that's when the Tibetan Buddhism, that's been really helpful, especially with the meditation, and getting the patients to really accept their conditions, and knowing that there's stress. And when we don't really accept that you are stressed, or when you judge yourself in a way, it's really going to affect yourself. So a lot of times I try, and if I feel the patient would benefit from it, I try and incorporate meditation with my treatment, so that it helps them as well. And another thing about pain is that pain is such it's like a sensory input to your body, just like your vision, your sense of touch. So pain is also a sensory input in your body, so you can really train your pain as well. And a lot of times pain is very subjective to people. Even when you have healed, even when the tissues have healed, we need to rewire and train the pain nervous system. so that and that so that you heal properly, and that really benefits from meditation and trying to train your body back to healing as well.
That must really benefit a lot of people with chronic conditions, right? Because they get so used to that pain.
Yes, so chronic pain basically more than 3 months, we refer them as chronic pain. And body is beautiful in the sense that you heal quickly, naturally body heals on itself. So that's one of the principles of osteopathy, is that we try and optimize the healing of the body. We are not there to heal your body, we're just sort of readjusting your body so that your body heals on its own. So
that's very empowering, actually.
Yes.
Is osteopathy similar to other healing sciences?
I would say they all have their own principles, just like the chiropractors and physios and even the doctors. We will have our own principles, our own. But our aim is to heal the patient, right? So, in a way, it's similar, but not really similar.
I guess different in diagnosis and treatment. Right?
Yes, diagnosis, treatment, management as well.
What do you enjoy most about being an osteopath?
I like the fact that I can help the patients and really try and empower them and help them manage their own pain, because my ultimate goal is to help the patient to have control over their own body. And also, a lot of patients rely on the external control to heal themselves. So like, I don't want the patients to depend on me completely. I want it to increase the internal locus of control rather than focusing on or relying on the external locus of control. So when I say that, trying to empower the patient and encourage them to heal themselves, and because they have control over their own body, it's them who can heal themselves, and I'm there to help them in the procedure. So that is my aim, and also it gives me joy when I see patients benefit from my sessions.
I'm sure when you're intrinsically motivated and you see people benefit, that brings a lot of inner joy for yourself.
Yes, it does, yes.
And finally, what does health and wellness mean to you?
For me personally, health and wellness is something where you are in control of yourself. In a way, you are aware of what you're doing, you are aware of your motives in this world, you are aware of your intention of what you do, and you are not just physically but mentally satisfied with that as well. So it's more to do with being happy with who you are as well.
Yeah, and unconditionally accepting yourself, Marue, like that concept it is.
Yeah. Because the more free you are in your mind, even if you're really sick in your body, but you're okay, and you see two people with the same condition, but they heal differently, even the pain level is different depending on their understanding of the pain as well. So it's such a big, a lot of factors contribute to it.
And that's really interesting you say, because actually I've interviewed a lot of medical practitioners that said that the positive attitude makes such a difference in the healing journey.
Yes.
And the same, like you said, same condition, but some people recover faster because they're just happier and more positive and more optimistic.
Yes.
Thank you so much.
Thank you.
Samten Choekyi. I really enjoyed it, and it was really empowering and really inspiring for me too.
Thank you.